Ladies and gentlemen, the woman you are about to meet is one of the modern day examples of a woman who can literally do it all and run the world. She is an entrepreneur, host of her own shows on TV and radio, and a woman who keeps pushing herself harder while using her power and influence to change the world for the better. On her TV show, We Got This Africa, she's given women a platform to talk about real-life experiences of the African woman. In her opinion, no topic is off limits, and it's in sharing these stories women find strength. Our host is an entrepreneur at heart and a role model for many other women seeking to have an impact and being determined and successful with their business. We couldn't be more proud to have her as our host for the first Women Empowerment Award. Ladies and gentlemen, your host, Naa Shoko from Ghana.
Hello and welcome. My name is Naa Shoko and I am honored to be your host for the very first Bayer Foundation Women Empowerment Awards. We're coming to you live from our studios here in Accra, Ghana, but we'll be hearing from all of our awardees and our speakers from across Africa and Europe. It's a great time to be a female entrepreneur. I'm sure most of you agree. Now, these are the words of Dr. Monica Lessel. She is Executive Director of the Bayer Foundation. And together with her team at the foundation, they started this initiative with a goal of supporting female entrepreneurs with groundbreaking ideas. But the question is, how do you identify, recognize, and celebrate the role of women as change makers, driving sustainability through social impact and entrepreneurial innovation? That's exactly what the Bayer Foundation Women Empowerment Award is all about. And in the next few minutes, we'll learn more about the foundation, this awards, the women who enter the competition, and how their innovation is driving change across Africa. But first, let me give you a quick recap of what has happened so far and what the path our awardees took looked like. Health for all and hunger for none. With this vision and philosophy behind the awards, we kick-started the application phase for this initiative in February 2021. Our sole goal was identifying the female entrepreneurs leading innovative social enterprises with a focus on Sub-Saharan Africa. On today's show, we get to learn more about the inspiring philosophy and ambitious goals of this award and the Bayer Foundation. We'll also hear the amazing, inspiring entrepreneurial stories of our 5 awardees, as well as meet our jury members who selected our awardees from 400 applicants from across Sub-Saharan Africa. And now, we're going to meet the 5 incredible women who are about to set the stage for the first ever Women Empowerment Awards. These women have been chosen from about 400 applicants from across Sub-Saharan Africa. All of them have gone the extra mile to impact and promote change towards a more just and more equal society. This is the first ever Bayer Foundation Women Empowerment Awards. This is just the beginning. Now, if you're watching us and thinking, hey, wait, that's me. It's me you're talking about. I am one of these 5 women. I am constantly going the extra mile and making a difference with my work and my company. I am that woman entrepreneur, aiming for a huge impact within my society. This is me. Well then, that's perfect. Because this is only the first edition of the Women Empowerment Awards. This is just the beginning. Applications for our 2022 Women Empowerment Awards will soon open. All you have to do is follow the link below to sign up for our newsletter, and you'd get all the information you need about the awards. You also get to follow the story of our 5 winners this year and how they will grow their impact and their company within the next few months. And I can promise you that it will be very inspiring. And now, I am incredibly honored to hand over to Dr. Monica Lessel. Monica is the Executive Director at the Bayer Foundation. She's also the Head of Corporate Innovation and Research and Development at Bayer. I know what you're thinking. Exactly. She's a big woman. She has been promoting innovation throughout her company, and her outstanding contribution to sustainability in science and her approach to understanding diversity is phenomenal. Monica, take us along.
Thank you, Na. Welcome to the award ceremony. My name is Monika Lessel, and I am the Executive Director of the Bayer Foundation. The vision of the Bayer Foundation is to catalyze science and social innovation for a world with health for all and hunger for none. One of our key goals is to close the gender gap by empowering women entrepreneurs in the developing world. The new Women Empowerment Award is one building block in this strategy. Studies have shown that women play a key role in driving change and working towards a more equal society. Gender equality and women empowerment are essential to achieve the 2030 Sustainable Development Goals. During today's award ceremony, we will highlight a number of examples which serve as best practice for women entrepreneurs and lead the path towards a more sustainable future with health for all and hunger for none. I feel very honored of being part of the selection committee for such outstanding and inspirational leaders. Today it's all about them. And I would now like to open, therefore, the 2021 Bayer Foundation Women Empowerment Award ceremony.
Thank you, Monica. What a fantastic and inspirational start to the show. Now, speaking of inspiration and role models, before I introduce you to the stars of the evening, who are our 5 awardees and their incredible stories, let me first introduce you to a true powerhouse of African female leadership and entrepreneurship. Any introduction shorter than 1 hour is probably missing out on major big achievements of Obi. But hey, let me just give you Dr. Obi. Dr. Obi was a candidate for office of the President of Nigeria in the 2019 elections. She's an economic policy expert and a senior economic advisor at the African Economic Development Policy Initiative. Obi was also the co-chair of the World Economic Forum African Regional Strategy Board and the co-founder of the hashtag Bring Back Our Girls movement and also of Transparency International. Now, I know you all can't wait to see and hear from and meet Dr. Obi, right? Well then, Obi, the stage is yours.
What a delight to be able to present this very short, I don't know, I don't think it's inspirational. There's nothing inspirational in what I'm about to say, except to let all winners, awardees, as well as those at this event know that we have no choice but to make it happen for women in our world. A world without the absolute optimization of the gifts and the talents of women deprives itself of humongous opportunity. When I look at what is going on today and realizing how the innovation of the 5 awardees of the Bayer Women Empowerment Award persuaded us amongst a list of 10 outstanding women, I just have only but optimism about our world. Today's science, technology, engineering, mathematics is a basis for closing the gaps quickly. Oh, gaps. Well, I don't know how many of you realize that the World Economic Forum gender gap analysis for 2021 says it will now take us 36 more years than what the number was last year for women to close the gap. So whereas it was something about 99 years to close the gender gap, By 2021, that number has gone to 136 years to close the gender gap. That's huge. So it means we must be in a hurry. And that is why the effort of organizations like BEA to identify women who are doing very interesting things, works of social impact, works that matter to the poor, works that enable us reduce the inequality gaps. Those kinds of things are going to be needed in their millions to enable women close economic gaps, close health, education gaps, close political representation gaps. Because some of the women in business today ultimately would need to be at the leadership table of countries. At that level, we begin to make tremendous progress, whether it's in the area of policies or institutions, or in fact, directing the kinds of investment that offer women better opportunities. We're going to need more women at the table. I just hope that no one who is watching our 5-hour days is ever thinking of giving up. There's no reason to give up. You must place your hand on what you have found to do and just keep doing it until BEA comes along or other organizations come along. For every one of us, we must recognize the importance of partnerships. It is partnership with Africa that's making BEA do what it's doing with the awards. It's only the beginning, I hope. And I am really looking forward to the kinds of amazing results that our 5-hour days will begin to post as a result of this strong partnership. Only 31% of the continent's women are in the field of science and research. That is a paltry number. We have to increase that, we have to accelerate that. And it means that each one of us who's gotten the privilege of education have a duty to the rest who are yet excluded from education. Making sure that all women are educated is so key to our becoming. We all must become.
Wow, Obi, that was wonderful. Despite Obi's own humble judgment, this is truly inspirational. And to all the women leaders out there, just keep doing what you're doing and do it with all the confidence and all the determination you can gather. Obi touched on a very important topic which we need not only to address, but to work on. Only 1% of the continent's women are currently in the field of science and technology. Now, that's not enough, and we clearly need more of the female role models who inspire young people to do this. We've all been waiting long enough now, I know. So let's finally get to meet our 5-hour Ds and hear from them and hear from the jury members as to why they stood out amongst all the talented, successful female entrepreneurs who applied. The first laudation we'll hear today is from Obi, who will introduce us to Angela, the co-founder and CFO of Cara Health based in Uganda.
Imagine that you have to walk 20 to 30 kilometers when you're pregnant or when you have complications to get medical assistance at the nearest hospital. It's an unfortunate reality, actually, for many women that live in rural Uganda. They endure this literally every time. It is so great that our first award winner is the Ugandan social entrepreneur, Angela Pyomugisha. Angela used to work at a bank in the city, but when the bank sent her to work in a rural area, she witnessed the hardship of rural women in Uganda. Together with 3 other co-founders, Angela came up with an idea. What if they could provide the local health clinics with the most needed medical equipment so that health clinics in the village wouldn't have to refer women to a faraway hospital. Cara Health was born, not long after the initial idea sparked in Angela and her friends. With their startup, Angela and her fellow co-founders provide healthcare solutions for small private-owned clinics and healthcare centers in the rural areas of Uganda. They do this by supporting them to upgrade their facilities and acquire more modern medical equipment, from dental to surgical equipment. That's a win-win situation because the clinics are able to serve more patients and generate more income, which they use to reimburse the equipment from Cara Health. How about the patients? Well, they no longer need to travel far away for simple medical treatments. The UN Sustainable Development Goal states that everybody should have the right to access affordable healthcare. This is a goal that Bayer Foundation fully subscribes to. Angela from Cara Health Care is a perfect partner for the Bayer Foundation. The foundation is inspired by her true commitment to improving access to healthcare for rural men and women in Uganda. Moreover, we both have a strong focus on improving the livelihoods of rural communities through developing business models that leave no one behind. With partners like Angela on our side, we will contribute to the third goal on the sustainability agenda, encouraging and ensuring healthy lives and promoting the well-being for all. Ladies and gentlemen, give it up for Angela.
In Uganda, while more than 80% of the population reside outside urban areas, and nearly all of our private facilities are located in a few towns and cities, and this serves less than 10% of the patient population. This has also resulted in acute shortage and in many instances complete absence of advanced care for communities that are located in rural areas of Uganda. Hi, my name is Angela Chomjisha, and I'm the co-founder and a CFO at Cara Health. At Cara Health, we ensure access to healthcare for the rural communities by providing finance for medical equipment as well as health infrastructure, and we also support them with IT and management for the clinics that are located in the rural areas. Initially, after school, I was working in the bank, but I had to change and find my passion. And so I co-founded Cara Health, which helps provide healthcare using the virtual system or online system for the communities that are underserved. In the remote villages of Uganda, there is lack of electricity end to end. And also they face a big challenge when it comes to health infrastructure and general infrastructure like the roads. For example, women that are pregnant and have to do visits to the health facilities have to walk over 10 kilometers just to get to the district hospitals or health facilities. But even when they get there, seeing a doctor is a problem because of long queues. And so with the support from Bayer Foundation, we shall be able to deploy container clinics in the areas that have been left out. And pregnant mothers, as well as their children and their families, will be able to access this healthcare on real time within 1 kilometer distance radius from their villages. We believe also at Cara Health that a sick person cannot be productive. And so with healthcare at their door, they shall be able to pursue their dreams to have healthy and prosperous families. This prize from the Bayer Foundation will help us scale out and expand to areas that we have identified that do not have any healthcare facility within 20-kilometer radius. The world is adopting to the solution of digital technology. I advise all the young girls out there to embrace the new technology. Challenge yourself. Keep committed to reading, researching, and embracing technology. Believe in yourself, because if you believe in yourself, your passion will follow through. And stay committed, challenge yourself. A woman that is empowered can inspire the rest of our community. And so do challenge yourself to be a follower of your dreams without doubt.
Believe in yourself and your passion will follow through. Wow, what a credo. Congratulations, Angela. We're also curious to hear about your Women Empowerment Award and how you feel about it. Over to you.
On behalf of Cara Health, I'm so happy and humbled to have been recognized as one of the winners, and we believe that with this support, with the growth accelerator, with all the support around us in the ecosystem from Bayer, we shall be able to reach the next miles. Thank you so much.
We are so excited and we really can't wait to see you grow further, Angela. Our next jury member and laudator is Andre. He's the chairman of the board of trustees of Bayer Cares Foundation and a professor of social ethics at Ingolstadt University. Andre, please take us along and introduce us to Caitlin, our next awardee from Kenya.
Abda's family was already the third generation to live in Mathare, a collection of slums in Nairobi. She was an exceptionally open and highly intelligent girl who soon attracted the attention of her teachers at the religious school and eventually managed to get a scholarship to attend the college to train as a teacher. Equipped with a strong will and unusual self-discipline, she fought her way up the academic qualification system. Just a few weeks before her final examen, however, she once again returned from the demanding preparatory course. Her head full of mathematical formulae, she overlooked a poorly lit car while riding her bicycle in the dark. The impact hurled her meters through the air and left her seriously injured on the road. Passers-by soon found her bleeding, but still alive. They dialed the number of a nearby hospital, but in vain. It took the emergency team more than 1 hour to arrive. Too long for Abda and for the love, hopes, and affection of her family, who died away with a bright young student. Ada's story is only one among thousands across Africa every day. Accident victims pass away in the streets of Nairobi and other Kenyan cities, even if their life could have been saved with a better organization of emergency infrastructure. The concept of flair here is very simple. In times of mobile and smartphones, as well as digital platforms, the goal of implementing such a rescue infrastructure could be reached very easy. All you need is an effective coordination between the already existing different teams, resources, and small systems in order to attain a nationwide reach. What we got used to in many other respects, this means coordination via the IT platform, could also be possible with emergency rescue via FLAIR. 4 years later, the idea has already been implemented to a good extent. More than 50,000 people, most of them in the capital Nairobi, are already covered through the virtual rescue parachute of FLAIR. But in a country with 50 million inhabitants and more, much still needs to be done in that respect. Scalability is obvious. In view of the millions of time, the sad fate of Ada is repeated every year in Africa.
The problem with ambulances in Kenya prior to FLAIR was that there was no central number to call. Patients had to call literally thousands of numbers to be able to reach an ambulance. And there was no way of knowing, is that ambulance actually available? Is it close? And so the majority of Kenyans would never take an ambulance in an emergency situation. It used to take about 162 minutes to get rescue services, and with FLAIR, we've brought that down to 15 minutes. My name is Caitlin Dolkart, and I'm co-founder at FLAIR. We aggregate all the existing ambulances onto one central system. On the other end, we allow patients to access our services through a hotline or a touch of a button via an app, which connects to our 24/7 dispatch center with trained and professional medics and emergency responders to be able to quickly dispatch ambulances. We started FLAIR in 2016. It took us about a year and a half to actually build the technology, form the right partnerships, get everything in place. And so we've been live and operating in the market for the last 3+ years. Currently, the number of ambulances that we have access to is over 200 ambulances that are actively using our platform in Nairobi and over 600 across the country, which is plenty to be able to operate a nationwide ambulance service. What motivated us to start FLAIR was that, having grown up in the US where 911 is a system that you really don't think twice about, the reality of not having that in a city or a country like Kenya, which is fast, growing and has so much, was actually mind-boggling. And so we both thought that, we had the tools, the technology to solve this massive global problem that not only impacts Kenya, but actually impacts 2/3 of the world. We have very limited margin of error. And so quality and maintaining the highest level of quality is certainly something that we're always, working towards. And we have, but it's something that you can't be complacent with and constantly requires time, effort, feedback, listening, and change to make sure that we're always delivering the best service, which we are today. But when I think about FLAIR, I think about it as Uber plus humans. We believe to deliver emergency services, you not only need Uber-like technology, but you also need dispatchers and emergency responders that are able to pick up the call, able to provide directions over the phone, that are life-saving and able to deliver that service. The way that we guarantee that there's always an ambulance available is that we have excess supply, meaning that we always have too many ambulances available and ready to respond beyond what we know the likely call volume is going to be. The way that we make our business sustainable is by charging a subscription. So everyone pays a little bit each and every year to ensure that we are able to operate 24/7, 365. With the Bayer Women in Empowerment Award, what we are looking to do is to scale both geographically as well as to scale our services within Kenya. And so we'll be looking to diversify to ensure that we can provide a 360-degree and holistic emergency response service. Our scale plans will impact the country because we'll be able to reach more. The impact of technology is huge. Everything that we use and have built upon is using today's technology. We are able to build a scalable, lightweight, cloud-based emergency response system only because of the technology that is available to us today.
Wow, Caitlin, that's incredible. Making life-saving health services available and accessible since 2016. Well done and congratulations. We are so curious to hear about your plans, being one of our very first awardees. Over to you, Caitlin.
Winning the Bayer Award is huge. Building a company like FLAIR is hard and often unforgiving. But with these important points of recognition, it really helps us. It helps us to scale, keep going, and achieve the impact that we want to have. Thank you, Bayer, for lifting us up and believing in us and showing the world what we can achieve together. A world in which, no matter where you are or who you are, you have access to emergency help in minutes. Thank you so much for the award.
No, we thank you, Caitlin. Thank you. What a great success story. Our next jury member and laudator is Sarah. Sarah serves as the head of Global Public Affairs, Science and Sustainability for the Crop Science Division of Bayer. Please introduce us to our next awardee.
Our planet isn't getting any bigger, but our demands on it are. Our world population keeps growing. This is especially true for the African continent. The population of Sub-Saharan Africa is projected to double by 2050. If we want to achieve our vision of health for all and hunger for none, we need to keep up the work to find sustainable solutions to feed everyone on our planet. Many farmers across rural Africa depend on livestock for food and income, and there's a tremendous need for farmers to have access to better productivity and animal health. In Nigeria, Cynthia Mene is the director and COO of Vetsark. She's a true social innovator and a business entrepreneur. As a COO, she leads Vetsark's mission to transform agriculture in Africa. Cynthia and Vetsark do this by helping small agribusinesses all across Africa. Vetsark uses data science and tech to help farmers and veterinarians digitize their daily clinical records, provide farm services, and animal health care. By supporting farmers to professionalize their businesses, we can help them to feed their families and build a stronger rural economy. Business entrepreneurs like Cynthia play a key role in making sure that the generations to come will grow up with better livelihoods and more opportunities. And her company is growing. Not only is Cynthia and her company serving farmers in Nigeria, the company has started to deliver services to farmers across Africa, from the DRC to Uganda, from Togo to Namibia. And the Bayer Foundation is proud to be a part of this journey to scale. Let's hear it for our third hero entrepreneur, Cynthia Mene.
Food insecurity has become a global discourse that one must really work towards to address. In Nigeria, we have over 88% of farmers who are stuck in a cycle of subsistence farming. And despite their economic importance, these farmers are still living below the poverty line of $1.9 per day. For our food system to become sustainable and equitable, these smallholders need to earn decent incomes from their activities. My name is Cynthia Mene. I am a director and the chief operations officer at Vetsark. Vetsark is an agri-technology company that helps agri-businesses increase productivity and income by digitizing their businesses. At Vetsark, we observe that one of the major causes of slow growth when it comes to the livestock industry, it's as a result of widespread prevalence in disease outbreak in Nigeria. And we've seen that Nigeria loses about $3 billion worth of income to disease occurrences. This has led to closures of farms and loss of thousands of jobs. Farmers have lost lots of their revenue just to disease outbreak. First, Vetsark came up with a solution of providing digital farm management, which is FarmGod. FarmGod helps farmers to easily record, track, and analyze data for financial transactions and production activities on their farms. Data science technology is used for predictive analytics. So at Vetsark, we are currently working on using data science to help predict poultry disease outbreaks in poultry and livestock. We are currently faced with three major challenges. One is visibility. We are working on increasing our marketing reach when it comes to getting farmers more aware of the value we provide and for them to be able to adopt our product. Number two is behavioral change. FarmGod is technology at its core. However, farmers are stuck in a cycle of analog paper-based of record keeping, and trying to change their mindset to a digitized format has proven to bring some form of resistance. So we need to educate farmers to be able to adopt a digitized method of farm management. Then thirdly is finance. In order to scale, we need more funding to provide more trainings to farmers, funding to also improve our capacity to deploy most of our technology tools. Digital innovation is key and fundamental for fighting against food insecurity, because farmers are running businesses, and in every business, or the core objective of every farmer is to be profitable. And to be profitable requires good farm management practices. But the heart of that farm management practices is digitization. So proper farm management using digital means would save farmers the cost or reduce the risks of inefficiency or losses when it comes to poor farm management, or when it comes to mortality as a result of like their poultry dying due to diseases. This tells us that if we have the farmers able to access information, market, finance, or even management services on digital platforms, this would be fundamental in helping us fight food insecurity globally.
Congratulations, Cynthia, and congratulations, Nigeria. Now, we're curious to know what you're going to do with this award over the next few weeks and months.
On behalf of the Vetsark team, I would like to appreciate Bayer Foundation for considering us for the Bayer Foundation Women Empowerment Award. This is such a delightful and one of the best experience for us this year, because it has provided us access to expert mentors through the accelerator program, training and opportunities to scale our innovative ideas across Africa. Vetsark is an agri-technology company that helps agri-businesses improve on productivity and increase their income through the digitalization of their farm. Our vision is to transform the agricultural sector in Africa through the digitalization of farm businesses. I want to use this medium to encourage young women out there with innovative ideas and looking for opportunities like the Bayer Foundation Women Empowerment Award. These would help you to improve on your ideas, scale your businesses, and provide game-changing solutions to sustainability and social impact. Thank you, Bayer Foundation. We love you and we appreciate you for what you do.
Congratulations, Cynthia. And next, you remember in Law Data is Daniela. Daniela is the VP and Global Head of Public Affairs and Sustainability and Consumer Health at Bayer. Please introduce to us Abimbola, who is the founder of My Medicines in Nigeria.
Abimbola Adebakin is the CEO and founder of My Medicines. The joyful entrepreneur was born in Lagos and studied pharmacy and business administration at the University of Lagos, Nigeria. This combination of unique skill sets put her in the right position to ask some fundamental questions about the state of the healthcare system in her country. Seeing people in rural areas struggle to access medicine brought her to develop My Medicines. My Medicines is an e-commerce platform for drugs and healthcare items in Nigeria. When Adebakin set out to develop mymedicines.com, she had in mind scale and access across the country, and this ambitious entrepreneur is well on her way. The platform aggregates medicines and medical items, 7,000 and counting, by the way, from more than 900 vetted pharmacies across the country. Not only does the platform help solve access and ease of purchase for users, it's also ensuring the safety of drugs purchased, as counterfeiting is still a huge challenge in the country's pharmaceutical space. We love Adebakin's smart mind, we love her energy and her entrepreneurial spirit, and we love to accompany her on her ambitious journey to scale. It's only by doing this, by partnering with the brightest minds, that we will achieve our vision of health for all, hunger for none. So let's give a loud shout out to Abimbola Adebakin.
Many medicines are not created in Nigeria. Now, when the medicines do come in, we have very limited range, and then the prices are sometimes unaffordable or volatile. They're concentrated in large cities like Lagos or Port Harcourt, and so for rural areas, they rely more on the patent medicine stores, and they don't necessarily carry the full array of medicine. So we do have a challenge with availability of medicines in the country. My name is Abimbola Adebakin. I'm CEO of Advantage Health Africa, and Advantage Health Africa is the promoter of mymedicines.com. So what we conceptualized when we started My Medicines was to be able to provide at the very last mile, meaning to be able to provide you with genuine medicines irrespective of where you are in Nigeria. That we're an aggregated online pharmacy. So it's known for access, it's known for affordability, and it's known for quality of medication. I think one of the challenges we face is providing logistics across the country, but then we're finding ways around it with partnerships as much as possible. I didn't start my business because I thought I was a woman. I actually just started it because I saw a gap. So I saw an opportunity from my years in management consulting to build a shared platform, and thought that, with a shared platform, many of the retail pharmacies can share access to a new market that was emerging when Nigerians began to, embrace e-commerce. I also saw a gap with individuals looking for medicines in top scale pharmacies and not finding them. My husband was at the time looking for a particular medical device that he typically got when he was in the UK, but he couldn't travel at that point in time, and we went to about 6 upscale pharmacies and just could not find. And I thought to myself, there must be some way of bridging the gap of these access issues. Medicines and medical devices exist somewhere and people exist elsewhere. So bridging it has been really the point about setting up mymedicines.com. One of the things that motivates me to keep going is the dream I have that by year 2027, when I will resign, I want to see access to medicines to become a common thing across Africa. What motivates me is to be able to put a solution in place that hundreds of thousands of people use on a regular basis, and it becomes norm for them to have access to healthcare. When we were applying for the Bayer Foundation Empowerment for Women Award, we were focused on 3 things. 1, we needed to improve our logistics. 2, we needed to complete our technology build-up. And 3, enhance our team, not just in the numbers, but even in the exposure. And those 3 things are becoming a reality now. When My Medicines is able to do hundreds of thousands of orders on an annual basis, what begins to happen is people can breathe a sigh of relief that access to medicines is no longer something they need to worry about.
Congratulations, Abimbola, and congratulations, Nigeria. Let's now hear from you on what you plan to do with this award and the Growth Acceleration Program.
My name is Abimbola Adebakin. I'm CEO Advantage Health Africa, and we are the promoters of My Medicines. What we have done with My Medicines is to find access to medication for genuine and affordable medication all across Nigeria for people. We process thousands of prescriptions on an annual basis, and the joy when people get their genuine and affordable medicines is enough for us. But to be acknowledged, to be recognized, to be awarded not just a grant, but also the training and the capacity building for myself and my entire management team is something that is really commendable. I must thank Bayer Foundation for the 2021 Women Empowerment Award that has been given to me. on one level, to be recognized is really fulfilling. But secondly, to encourage African women to step forward, to innovate, and to find solutions to African problems. I think this is highly commendable. I urge more women to go for the award or to go for the empowerment program, wherever you find it. Step forward, let your work be recognized. Let it be seen by the world. Let it be recognized that African women are solving African challenges. Thank you very much, Beya Foundation. I really cherish this.
Step forward and be recognized. African women solving African problems. Wow. Thank you so much for your encouraging words. And congratulations once again. Now let's meet our next Law Data and Jury member, Dr. Monica, introducing to us Morinike from Whispa Health in Nigeria. Over to you.
Having an unplanned child can derail the lives of young Africans, especially young females, in significant ways. The Nigerian entrepreneur Morinike Fajemisi has seen the painful consequences for young women and girls who became pregnant, and she decided that something needs to happen. From her experience, she knows that unintended pregnancies can have significant impact and lead to fewer educational and development opportunities. In fact, 1 out of every 5 women in Nigeria has given birth by the age of 18, and the use of contraceptives remains low. There were 3.4 million unintended pregnancies and 2.7 million abortions in 2019 alone. These problems are worsened by the lack of shame-free and confidential access to quality sexual and reproductive health information. So Morinike thought there is a real need to act, and she founded Whispa Health. Whispa Health is a judgmental-free mobile application that provides young people access to high-quality reproductive health information, products and services. And thanks to her energy and entrepreneurial mindset, Morinike has created a platform that offers stigma-free access to sexual health services for 19,000 Nigerians. But her goals are even higher. Morinike wants her platform to become the #1 provider for sexual and reproductive health in Africa. We from the Beya Foundation are very proud to have a partner like Morinike, whose ambitions are higher than the sky. At the Beya Foundation, we have the fundamental belief that empowering women and girls and providing them also access to family planning will be key to achieve the 2030 Sustainable Development Goals. This is also in line with our mission, Health for All and Hunger for None. Family planning plays a crucial role in reducing poverty and improving health and well-being of communities, ensuring high-quality education and economic growth. It's about the freedom to decide when and how to have a family. The Beya Foundation is really proud to support female entrepreneurs like Morinike who see opportunities in some of the most difficult challenges to tackle. Thanks to her and the platform, the future looks indeed brighter and with more opportunities for many young Nigerians. But now it's time to hear and see the story from Morinike herself.
In 2019 in Nigeria, there were 3.4 million unintended pregnancies and 2.7 million abortions that occurred. Nigeria still has one of the highest rates of new cases of HIV infection annually in Sub-Saharan Africa. I'm personally motivated to solve this problem because when I was just 5 years old, I had a cousin who got pregnant when she was 18 and was unable to continue with her education. This situation has a way of changing the entire trajectory of a young woman's life, and this is why Whispa is here to solve this problem, not just for my cousin, but for many more young women like her. My name is Morinike Fajemisi. I'm a pharmacist, a public health professional, and the CEO and founder of Whispa Health Limited. Whispa Health is the creator of Whispa mobile app, a solution that makes it possible for everyone, and young people in particular, to privately access sexual and reproductive health information, products, and services. On Whispa, our users can chat with doctors about any aspects of their sexual and reproductive health needs, and they can also book appointments for a wide range of services like contraceptives, STI testing, cervical cancer screening, vaccination, and more. Our users can order sexual health products and have it delivered to their homes or offices in plain, discreet packaging. Whispa seeks to address problems such as high rates of unintended pregnancies, unsafe abortions, poor and limited sex education, and high rates of transmission of HIV and other sexually transmitted infections. These problems are worsened by our society's cultural and religious biases towards young people when they try to access any form of sexual and reproductive health care. So when we provide our solutions and sex education, we do so in a culturally sensitive manner with the aim of improving health-seeking behavior. We recognize that even though Nigeria has over 53 million smartphone users, we are still not able to reach every single young person that wants to take advantage of the solutions that Whispa has to offer. So this is one challenge that we are going to be able to address in the near future by expanding our digital touch points beyond the mobile application. With the help and support of Bayer Foundation's Women Empowerment Award, Whispa is well on its way to achieving our goal of reaching over 200,000 users within the next 1 year. This means that we'll be able to reach many more young people, especially women, with access to sexual and reproductive health information, products, and services that is shame-free and confidential. This means that in the near future, when a young woman wants to learn about her body, wants to ask questions about any aspect of her intimate health, all she needs to do is whisper.
Wow, Morinike, that was simply amazing. Congratulations to you one more time, and we are so pleased to have you as one of our awardees. Now let's hear from you on what you intend to do with this award and your participation in the Growth Accelerator program.
Thank you, Bayer Foundation, for providing a platform for this woman to be able to bring her solution called Whispa to many, many more young women in Nigeria, ensuring that so many people have access to sexual and reproductive health care. I'm honored, I am glad, I'm excited that I'm able to bring this vision to reality and that I have the support of Bayer Foundation working with us along our journey. Thank you, Bayer Foundation.
Congratulations, Morinike, and thank you so much for giving us an outlook on what you intend to do with this amazing award. What a selection of strong and powerful female entrepreneurs. Thank you so much to our dear jury members for your fantastic laudations and introductions to our very first 5 Women Empowerment Awardees: Angela, Caitlin, Cynthia, Abimbola, and Morinike. This has been amazing. Thank you all so much. The applications for the 2022 awards will soon be open. Please follow this link below and sign up for our newsletter. Like this, you'll get all of the information you need to know about next year's competition and you will not miss out. But now, let's hear from Maru. A quick look back, but also ahead to what's to come.
Wow, this has been a truly inspiring award ceremony. The project companies and founders are visionary impact leaders and role models for others, especially women. Being a supporter and advisor for the Bayer Foundation for many years, while being an entrepreneur myself, I'm really happy to see with how much dedication the Bayer Foundation is into this. Setting up the first Women Empowerment Award, driving attention to this important topic of female entrepreneurial leadership, and really diving into the scene, finding these exceptional women leaders in the field of health tech and ag tech, solving basic problems for many. Basic, but life-changing. Most importantly, what I truly love and appreciate is that we really looked at the sustainability aspect. How sustainable is the business and how big can this become? And how visionary, driven, and humble is the founder and leader behind it. So congratulations from my side and keep on scaling impact globally.
Thank you, Maru, and thank you all for staying with us and witnessing the very first Bayer Foundation Women Empowerment Award. I am stunned and absolutely impressed by the excellence and impactful stories that we've seen and heard today. And I can't wait to see how all of our 5 awardees will grow within the next few months. There's so much to come, and I'm sure of that. Please follow the story of our female entrepreneurs and stay up to date with all of the updates regarding the Bayer Foundation and the Women Empowerment Awards. Just click on the link below to register and you can sign up to our newsletter. You can also follow us on our LinkedIn page for all of the updates. You will not miss any update. We'll inform you about everything as soon as the applications for 2022 open. Stay curious, determined, and hardworking. And remember that the greatest is still yet to come. Keep pushing forward. And thank you for watching the very first Women Empowerment Awards. My name is Na Ashakor, and it's been a real honor to be your host. Thank you.